I'll be discussing an Obamacare alternative, so stay tuned. I'm Keith Armbrecht, founder of Exit Obamacare. I hope you'll find the information in this video very helpful and presented in an easy to understand format. Health insurance today has become increasingly unaffordable. Premiums continue to skyrocket while benefits continue to decline. Now, the Affordable Care Act makes it mandatory that everyone purchase health insurance. This is proving to become a burden on many individuals and families. Healthy individuals who rarely seek medical care are now required to pay the same premiums as those that require significant attention. This is why I've created Exit Obamacare. Most do not realize that healthy individuals still have another option to purchase real insurance from a well-known national carrier at a fraction of marketplace prices. So please take a few minutes to explore my site. I'll show you how to take advantage of your good health and lower your premiums dramatically. You'll also find in our resource center links and videos to everything Obamacare. So please take a few minutes to look around. I'm sure you'll find everything that you need. Now, it would also be a great idea if you subscribe to my YouTube channel. That way you'll always have access to my videos and you'll get updates as they come along. So thank you for taking the time to watch this video, and I hope that we're able to help. Okay, so let's now talk about cheap health insurance. And I kind of preface that because this really should not be titled cheap health insurance. What it should be titled is less expensive health insurance, because there's absolutely nothing cheap about what I'm going to show you. This is a real PPO plan with a national carrier that has over 1 million doctors in their network, and it is true insurance. And most people don't realize that it's available. So we're going to get rid of that word cheap, and I'm going to show you exactly how this could work for you and or your family. So what we have right now is we have a problem with medical insurance. That's pretty obvious. The Obamacare plan is on the ropes. It is literally failing. It's imploding, and it's going to get worse before it gets better. There are really two segments of the Obamacare plan. There's one where folks that get a subsidy, in other words, the government is paying their premium for their health insurance. It's working terrific for those folks because they don't have to come out of pocket for their premiums. Now, the other segment is folks that do not get a subsidy for Obama plan, and you have to pay the full amount of premium for these marketplace plans. And if nothing else, you've seen massive rate increases, certainly recently massive rate increases, and it's becoming completely unaffordable. And the problem is you're mandated to buy insurance. If you don't buy insurance, the government is going to assess a penalty to you. So we need a solution. And what most don't realize that if you're healthy, you can find a very viable solution, something that's much less expensive than what the marketplace plans are. And I'm going to show you exactly that. So if you can't afford the hundreds or thousands of dollars in premiums, and I know people all over that are paying more for their health insurance than are paying for the mortgage on their home, and that's an absolutely unacceptable situation. Maybe your group plan at work is too expensive, or maybe your group plan at work is terrific, but your spouse and your children are too expensive on that group plan. A lot of times the employer doesn't contribute to the spouse or the children, so you may be able to get your spouse and or your kids onto this PPO type plan at a much lower cost than what you're paying for at work. So let's go through and tell you exactly what we're talking about. This is a PPO plan, again, real insurance with a national carrier, and that national carrier is United Healthcare. It's no secret. So United Healthcare is obviously one of the largest carriers in the country, and there is this PPO plan available. But what makes it less expensive is you have to qualify. So you have to be healthy in order to get it. And that's the other problem with the marketplace plans, is whether you're healthy or not healthy, you pay the exact same rate. So those that are healthy are paying significantly more than they should because they're paying the exact same rate as somebody that is in very poor health. So this is bringing you back to real insurance where you're rated on your individual situation and will work for most individuals and families. Now, it can be set up to cover 4 doctor visits each year with a copay. Drug coverage can be added to the plan. It can now run for 12 months in most states. Some states are still only 6 months, but it's a plan that has a specified period of time. And at that end of time, you can reapply at the end of the term. So it's something that can work for most folks. And again, you have to qualify for it. So that's what brings the premiums down. It can start as early as tomorrow. So if you fill out your application today, you can start your coverage tomorrow. And we have it set up where you can do everything yourself. You don't have to talk to anybody. You don't have to be sold on anything. Simply go to exitobamacare.com and you'll see here that there are 3 videos on the homepage tell you exactly what to do and how to do it. So the first video up top shows you kind of an overview on how everything works. The videos on the bottom show you how to make a short-term plan work for the long term. And then the other video is how to select your plan. I make it very easy for you to go online and reduce your options very significantly down to just 2 choices. So I'll show you exactly which 2 plans you should pick from. There's one that's kind of a base plan, and there's one that's a little more robust. Depends on what you want to do with your health insurance. You pick one, put it in the shopping cart, check out, and again, it can start as early as tomorrow. So it can start for you very quickly, and it will protect you and your family from huge medical bills with low out-of-cost options, and likely less than what you're doing on the Obamacare plan right now. So United Health One, which is United Healthcare, provides access to over 1 million doctors in their PPO network. So it would likely be more difficult to find a doctor that does not accept United Healthcare as opposed to finding a doctor that does accept United Healthcare. For most, it's apples and oranges in cost compared to expensive regular plans. It's less expensive. So you can reapply at the end of term, and that's the beauty of this. It's coordinated, so if something chronic does come up during your 12-month period, you can always get back into the Affordable Care Act. You can always get back into Obamacare. But let's save as much money as we possibly can right now. And if something does happen, we'll cross that bridge when we come to it, and we can jump right back in to the Affordable Care Plan. So go to exitobamacare.com. I show you exactly how to do everything that you need to do. I explain it. I want you to understand it completely so that if it is the right choice for you, you know exactly what you're doing. Watch the short, simple videos that explain everything, shows you an overview, shows you how to make it work, shows you how to sign up. And again, you do it on your own, so it makes it very, very easy. And then at the end, save, save, save. That's all we want to do, is provide a better alternative for your individual health insurance. So I hope you found this very helpful, and visit exitobamacare.com. We have all the information right there, and I hope you have a fantastic day.